Sexually transmitted disease basics. STD are sexually transmitted diseases.
Depending on the disease, the infection can be spread through any type of sexual activity involving the sex organs or the mouth. The infection can also be spread through contact with blood during sexual activity.
STDs affect men and women of all ages and all backgrounds.
STDs have become more common, partly because young people are becoming sexually active at a young age and are having multiple partners.
People can pass STDs to sexual partners even if they themselves do not have any symptoms.
Frequently, STDs cause no symptoms, especially in women.
Yet, health problems from STDs tend to be more severe in women.
They can lead to cervical cancer, pelvic infections, infertility,
and scarring of the reproductive organs, which can result in ectopic pregnancy, a pregnancy outside the womb.
Also, STDs can be passed from mother to baby before, during, and after delivery.
Because the method of becoming infected is similar with all STDs, a person can easily pick up more than one infection at a time.
Experts believe that having STD that is not HIV increases one's risk for becoming infected with HIV.
Causes of sexually transmitted diseases.
Depending on the condition, sexually transmitted diseases can be spread by any type of sexual activity.
STDs are most often caused by viruses and bacteria.
Symptoms of sexually transmitted diseases.
Common sexually transmitted diseases have a variety of symptoms,
If symptoms develop at all,
and many different complications, including death.
Some basic facts and symptoms of common STDs. Chlamydia.
most common of all STDs caused by bacteria.
No symptoms in 80% of women and 50% of men.
Discharge from the genital organs, burning or pain during urination.
Enlarged lymph nodes in the groin area.
Transmitted through any type of sexual contact.
Ectopic pregnancy and infertility for women are among the most serious complications.
Most treatable with antibiotics.
Genital herpes.
One type of herpes typically causes cold sores in the mouth, and another type causes genital sores. However, each type can cause either type of infection.
Recurring outbreaks of blister-like sores on the genitals.
Can be transmitted from a mother to her baby during birth.
Reduction in frequency and severity of blister outbreaks with treatment, but not complete elimination of infection.
Hepatitis A, B, C, and D.
Hepatitis B is most often associated with sexual contact.
Yellowish skin and eyes, fever, achy, tired, might feel like the flu.
Severe complications, including cirrhosis and liver cancer,
can turn into a chronic infection or can be cleared by a person's own immune system.
Medications can manage the disease or help the immune system clear it from the body permanently.
Immunizations available to prevent hepatitis A and B.
In combination with hepatitis B, hepatitis D has the highest mortality rate of the hepatitis infections, at 20%. Ectopic pregnancy and infertility for women most serious complications.
Treatable with antibiotics.
Treatable with antibiotics.
More serious complications associated with later stages of disease if undetected and untreated.
Chancroid.
causes painful ulcers on the genitals.
Can be confused with syphilis or herpes.
Treatable with antibiotics.
HIV.
Spread primarily by sexual contact and from sharing needles.
Can be transmitted at the time a person becomes infected with other STDs.
Fatigue, night sweats, chills or fever lasting several weeks, headaches, cough.
No current cure but medications available to slow disease progression.
Genital warts.
Caused by a virus related to skin warts.
Small, painless bumps in the genital or anal areas. Sometimes in clusters that look like cauliflower.
Various treatments available. For example, freezing or using a topical agent to burn the warts.
When to seek medical care for a sexually transmitted disease.
If you believe you have a sexually transmitted disease or have been exposed to an STD, a medical exam may be necessary.
Seeing a healthcare provider as soon as possible after exposure to an STD is important. These infections can easily spread to others and can have serious complications.
Go to a specialized doctor in these circumstances.
If a fever or severe pain develops with other symptoms.
If it will be a couple of days before an appointment is available.
Exams and tests for sexually transmitted diseases.
Some STDs can be diagnosed without any tests at all.
Other STDs require a blood test or a sample of any unusual fluid, such as an abnormal discharge from the genital organs, to be analyzed in a lab to help establish a diagnosis.
Some tests are completed while a person waits. Other tests require a few days before results are available.
Treatment for sexually transmitted diseases.
Home treatment of STDs is not recommended, because prescription drugs are usually necessary.
The treatment of an STD varies depending on the type of condition.
Some STDs require a person to take antibiotics either by mouth or by injection.
Other STDs require a person to apply creams or special solutions on the skin.
Often, another exam by a healthcare provider is necessary after the treatment to confirm that the STD is completely gone.
Some STDs, such as herpes and HIV, which can lead to AIDS, cannot be cured, only controlled.
After treatment for a sexually transmitted disease.
Sometimes, people with sexually transmitted diseases are too embarrassed or frightened to ask for help or information.
However, most STDs are easy to treat.
The sooner a person seeks treatment and warns sexual partners about the disease,
the less likely the disease will do permanent damage, be spread to others, or be passed to a baby.
If diagnosed with an STD, follow these guidelines.
Seek treatment to stop the spread of the disease.
Notify sexual contacts and urge them to have a checkup.
Take all of the prescribed medication.
Return to the doctor for a follow-up test.
Consult your doctor with specific needs and questions.
Avoid sexual activity while being treated for an STD.
Sexually transmitted disease prevention.
The best way to prevent sexually transmitted diseases is to avoid sexual contact with others.
If people decide to become sexually active, they can reduce the risk of developing an STD in these ways.
Learn the symptoms of STDs.
Be abstinent, refrain from sex entirely, or be in a monogamous relationship. Both sexual partners are each other's only sexual partner.
Delay having sexual relations as long as possible.
The younger people are when they become sexually active, the higher the lifetime risk for contracting an STD.
The risk also increases with the number of sexual partners.
Correctly and consistently use a male latex condom.
Do not rely on it. Or have regular checkups.
Avoid having sex during menstruation. HIV is passed more easily at this time.
Avoid douching, because it removes some of the natural protection in the vagina.
The HIV drug Truvada has been approved for use in those at high risk as a way to prevent HIV infection.
It's to be used in conjunction with safe sex practices.
Outlook for sexually transmitted diseases.
Most of the common STDs can be cured with treatment.
With the exception of HIV, which can be slowed, but not eliminated.
But others may lead to more serious, long-term problems, including infertility and problems in newborns infected by their mothers during pregnancy.
Some of these problems are blindness, bone deformities, mental retardation, and death.